already got an idea that her height and weight, of the congruency of height and weight, the congruency of age and appearance. She's giving me great eye contact. She's kempt. Her affect is what? What would you consider it?
Pleasant.
Pleasant. Right. Anything else? Is that all that's on there? That's all that's on there. Now we're going to go to skin. I need her really to be a little more undressed than she is, but we're not going to do that. It's not appropriate right now. But I'm going to check all of the skin. Something students seem to forget is to check both sides, because they see me up here and I'm checking one side while I'm talking. Well, when they get up here and they check one side, totally forget the other. Okay? So do as I say, not as I do. You need to go around to both sides. You're going to check as much of the skin as you possibly can for things like, start naming them, macules, papules, nevi, any kind of lesion, acrocordons, antigones, etymosis, petechiae, abrasions. I mean, you have a whole host of things to choose from. Lesion includes tattoos, any overt scarring. So what I'm seeing on what we have available is some scattered macules and nevi. And do you have any tattoos? No. No. Have you had any prior surgeries? Yes. Okay. Well, I'll probably get to that scarring a little different. No. All right.
You'll see one surgery, but not the other.
All right. If I wrote surgery.
No.
All right. No, I will not see that. Probably. That's not one of those things that I'm trained for. So we're looking for the color. We're looking for the distribution. We're looking for any kind of lesions. We're checking the temperature with the dorsal side of our hand. We're checking the Kurger. Well, I can check it here on her because she's under 50. Yes, I do. Thank you very much. And I notice a nice scar on this hand, right in through here. So something has happened. Was that a burn or a burn? Okay. What else am I looking for?
Moisture.
On hair, skin, nails, right. What else for the skin now? Look for surgery. What else am I looking for? If she were 85, you better tell me bony prominences. Okay? And you have to get down and look at the ankles. You have to look at the elbows. You have to look at the hips. You have to look at the coccyx. And it's embarrassing to do so, and I'll tell you what, if you've only got a few minutes, you're going to be so tempted to not take a look at those heels. Because you've got to get down and you've got to rummage around and you've got to look. But trust me, heels are one of the first places that you can develop pressure ulcers. Right. So make sure you look. The hair. I can do this, but am I going to see anything? And that's what students want to do, is they want to stand on one side and say, I'm going to check for any pests. You know, you're not going to find them if you just do that. We're pretty sure she doesn't have any, but if you were in a real life situation, I did camp nursing, found a lot of pests. You're looking for the color, you're looking for the distribution. No alopecia. How many kinds of alopecia normally are there? 2. Alopecia areata, which is area, little patches that would be missing, and alopecia totalis, I heard from somewhere. So, I'm going to do, can I mesh your hair out? All right. What I'm going to do is I am really going to look. I've also looked at the texture, and I'm getting a really good idea of the texture while I feel. Let's scoot you up just a little bit. And I'm not seeing any pests, but I'm also getting an idea of the thickness or the fullness. And is her hair healthy? Which it is. I want to see you look. Pests love the back of the neck and behind the ears for some reason. They're crazy about that area. Okay. We go on to nails, everything covered in the hair. Take a look. Is it? Yep, right. Looking for the color. Are they pink, which I want them to be? What's the shape? They're convex, which I want them to be. No koilonychia, which is student. No clubbing, which is club. And if I'm not sure about the clubbing, I can have her. And if we can see that little diamond in there, then she does not have any clubbing. Because 180 degrees, over 180 degrees would prevent us from seeing that. I want to check cap refill. It's nice and brisk. I'm looking at the skin surrounding the nail for any infection, which might be called paronychia, and I don't see anything like that. Remember, go back to the beginning and think of all those things that we can gather, that information we can gather from just looking at the nails, okay, and looking at the hair. All right, so we've done general survey, hair, skin, and nails. We're going to go on to HEENT, head, eyes, ears, nose, and throat. The first thing you want to do, when you were examining her hair, you could have gotten an idea of the shape of her head. What would you consider it? Normal cephalic rather than hydrocephalic or hydrocephalic or microcephalic. Now I want to look at the symmetry. I want to make sure the eyebrows are placed the same. The nose is square in the face. The folds are all equal. That the ears are placed on the head. And they are. She has nice symmetry. Everybody is just a little different. This makes me incredibly nervous. I've never been filmed before. All right.
It's not here, so.
Huh?
I said it's not here. Just pretend it's not
not
here.
here.
No.
All right.
Mm.
I'm just going to take a
Just
real quick
pretend.
look at the ears to see if they're draining. And while I'm doing that, and that is not on your sheet, while I'm doing that, I can check to make sure she's got good recoil in her, on her, what is it, the tragus and the pinna? Pinna? All right. So now, I'm going to go to the nose. And I want you to look back for me, and I'm going to shine a light up your nose. I'm looking for any kind of drainage. I'm also looking for an overt deviated septum. Everybody's one hole will be a little bit larger than the other. That's normal. You're looking for something really grossly abnormal. Can you sniff? Can you smell? Look and see the patency of the nostrils. Okay, I'm going to go on to your mouth. Okay, now you have to say ah, ah. No, stick your tongue out and say ah, ah. Big ah, ah. No. You're going to have to stand up because I can't. Okay, now, ah. Stick your tongue out when you there. Now say ah. Ah. Wonderful. All right. What I'm seeing, I'm not going to make you do it again. I'm looking at the teeth. Want to make sure there's no broken teeth, no missing teeth. Why? Yeah, later on down the road, that's going to become important because it might affect her nutrition. Looking at the mucous membranes, I want to make sure they are moist and pink, and that there are no lesions, no thrush.